Yes, my background is in environmental sciences. I did a master's program at Wageningen University in the Netherlands in the 1970s. This was a new program at the time because everybody was starting to get interested in the environment. The program that I followed was general environmental sciences, so it included water pollution, soil pollution, air pollution, toxicology. There was also a track that was focused on environmental health more from an epidemiology point of view. In the last phase of my master's education, I did some studies in environmental epidemiology. When I graduated, I got hired by the university as an assistant professor. And as part of that position, I was able to do a PhD project. I defended my PhD thesis in 1985. It was called The Relationship Between Environmental Lead and Blood Lead in Children. Well, it should be environmental and it should be epidemiology. That seems pretty obvious. But we want to see studies that are really trying to make an association between environmental exposures and health effects in populations. That sounds obvious, but it's not always easy to actually find good studies that have credible environmental exposure assessment and have credible assessments of clinical and public health effects. So that's what we're trying to look for. Well, the methodology needs to be sound, so it needs to be clear what methods are being used. The methods need to be validated. We would like to see studies that are actually based in environmental assessments of one kind or another. We now see lots of studies that are based on existing large databases, which may have some variables that are directly or indirectly linked to the environment, but not necessarily always. And I think it's important for people who publish in environmental epidemiology that they actually know what the environment is all about, that they've been able to do field work, been able to knock on doors, visit study populations, and not just sit behind computers and work on large databases. Common mistakes that authors make is that they are trying to make somewhat more firm conclusions from their work than is justified by the data. So we carefully look at the abstract, we carefully look at the concluding sections of the paper, and try to make sure together with the authors that they're not drawing conclusions which are not sufficiently supported by the data. Well, there's not too many journals that are focused on environmental epidemiology. There's a few journals that are focused on environmental health. There's one journal that is actually called Environmental Health. That's close to our journal in terms of the kind of stuff that they publish. There's of course Environmental Health Perspectives, which is now discontinued because of budget problems in the government of the United States. Let's wait and see what that will lead to. There's a few other journals, like the Journal of Exposure Science and Environmental Epidemiology, that we consider to be the friendly competition, so to speak. But there's not too many journals that are focused on environmental epidemiology as such, and I think we have a niche in the field where we do get an increasing amount of submissions from the field that are focused on environment on the one hand and epidemiology on the other hand. Well, that's hard to say. The future is hard to predict, as we know. We've been around for 7-8 years now, and we see a gradual increase in the number of submissions, which is good. We've received an impact factor journal citation index some 3 years ago for the first time, and that's slowly increasing for what it's worth. We are closely linked to the International Society of Environmental Epidemiology, so we are the official journal of the ISEE. And it's a very important venue for members of the society, also junior members. We've got lots of young folks joining the society to be able to have a journal where they can publish their work. And where we want to be 5 years from now, I would hope that we still are able to publish good papers in environmental epidemiology, and that the impact factor, again, for what it's worth, will increase, because that shows that's one way of judging the recognition of the journal, and that we are, up there with the other environmental health and environmental science journals and seen as a good journal to submit your work to. Well, we're of course dependent on the submissions that we receive. We interact closely with the ISE, as I mentioned, so we are seeing the majority of the papers actually coming out of members of the society. And it's, I think, a mutually stimulating experience. The society knows that it has a venue that is very keen on receiving submissions from society members. And the journal is depending to some extent on the society to publish work that is of interest to the society, and the society is not just a scientific society, but it's also very much a public health organization that tries to make things better in the world from an environmental health point of view. It's also trying to do this in a very international way. So the society has regional chapters, one in Africa, one in the Middle East, one in Asia, one in South America, one in Europe, one in North America, that are actively searching for ways to improve the science, not only in the United States and Europe, but in other parts of the world as well.